Hello everyone, we're going to talk about atropine, which is anticholinergic drug, and of course is used widely in anesthesia. Let's start as usually with mechanism of action. There are many but essentially atropine inhibit acetylcholine activity at the postsynaptic receptor. So it inhibits coupling of acetylcholine with muscarinic receptors. And of course, in this way, if one receptor is inhibited, predominate another one, so sympathetic activity will predominate with atropine administration. If to look at the body and understand every effect at different levels, from example, eyes, atropine acting on blocking some effects of muscarine and disinhibit or predominate alpha 1, which is sympathetic, and this one will produce a dilation of the pupil, which is equal with mydriasis. At the level of glands, it have inhibitory effects, so salivary glands inhibitory effect, glands at the level of the pulmons inhibiting so dryness of all liquids from the pulmonary mucous level, inhibiting secretion at the level of stomach, inhibit secretion and peristalsis at the level of intestine, inhibit secretion of the sweat gland. How about organs effect? For example, at pulmonary level it produces bronchodilation. At the level of the heart it increases heart rate. At the level of the intestine it inhibit peristalsis. At the level of urinary bladder it inhibit urinalysis. So I associate sympathetic activity with men or women, with people who are running and are stressed. When you are running, you have a dilated pupil. Everything is drying in your mouth as you are stressed. Heart is going rapidly. Every secretion is inhibited, and you don't have to go to toilet with any of the cause like emptying urinary bladder or intestine. Let's talk about pharmacokinetics. So half-life of the atropine is 2 to 3 hours and 7 hours in children. It of course differs depending on the patient age. Peak plasma time is 3 minutes, so you have to administer atropine by time earlier to have effect, which is kindly immediately, but to have a high peak of the effect you have to wait at least 3 minutes. If it is administered intravenously, it have immediate effect. Intramuscular, it have a prolonged effect. So we can administer with different ways, and even by bronchodilation within 15 minutes and maximum within 1.5 hours. It is by oral inhalation, but it is used rarely. Distribution, it goes throughout the body, it crosses the blood-brain barrier and have of course some side effects at the level of the brain, which can be changed to glycopyrrolate, which do not cross the blood-brain barrier and do not have these effects. Absorption from the upper small intestine, but want to repeat for you that usually it is administered intravenously. Metabolites, tropic acid, tropine, and possibly ester. And of course via the enzymatic hydrolysis via liver it is metabolized. What are the indications and doses for atropine? As we discussed at different level of organs, and we're knowing well now what are our goal for administering. In anesthesia, for example, we're giving as a premedication for clearing secretions or diminishing all the secretions to facilitate intubation For example, 0.4 or 0.6 milligrams 30 or 60 minutes before anesthesia, and it even can be administered immediately when you need. The half time have around 4 hours, so if you want to maintain the effect at every 4 hours, or as you need or as you consider, you can administer additional dose. In sinus bradycardia, like 0.5 or 1 milligram can be administered every 5 minutes. But there is one important thing that you have to do not exceed 3 milligram. In bronchospasm, you can administer 0.025 milligram per kilogram via nebulizer, very rarely used. And of course, in organophosphate poisoning. What are the side effects of atropine? A lot of, but the main one are anticholinergic symptoms like mydriasis, hyperthermia. Hyperthermia because of inhibiting sweating glands secretion, which is a mechanism of losing temperature or losing tachycardia, cardiac arrhythmias from tachycardia as increasing heart rate, and delayed gastric emptying. Also, fever, headaches, insomnia, dry mouth, anhidrosis, urinary hesitancy, dry skin, blurred vision from this cycloplegia of increased diameter of the pupil, photophobia, palpitation, dyspnea, paralytic ileus, it produces constipation, and many others. People who have problems with eyes, it can increase intraocular pressure. Thank you very much for your attention. Hope this short video is useful for you in many of the exams.